Hello everyone, today is November 12th, which means, if you could believe it, that I am 11 months post-op. Yeah, that went by fast. I apologize for the lighting, it's just dark outside and this is the lighting in my room right now. But I want to do a little bit of a chest update because I've been experiencing something new. I'd want to say in the past week, maybe even in the past few days. Not really sure when it started, but it makes me very uncomfortable, so I apologize for my lack of valid explanation of what is happening. But okay, so up until this point have had no nipple sensation. I didn't expect to because it's not, uncommon to not have nipple sensation after top surgery, and on top of that, I had a previous surgery before top surgery, so in my head I was like, my nipples were already so fucked up that the likelihood of them having any sensation was so low that I didn't even worry about it. It wasn't even a factor in like choosing a surgeon or anything like that. So I've not really paid much attention to them. They do weird things sometimes, like they don't respond normally to stimuli, I guess. Like sometimes when I get out of the shower and I'm cold, like one of them will get hard but the other one won't, and then sometimes they just like crinkle up. I don't know. It's weird, and I try to not pay attention to them because they make me a bit uncomfortable. But in the past few days I have been experiencing it's not like a tactile sensation that I could describe with words. It's more of a sudden awareness that they are there. I get a sensation that I just feel their presence all of a sudden, and it makes me really uncomfortable because I'm cognizant of the fact that my brain knows they're not where the sensation is coming from. Does that make sense? Like, I'm sure you guys know when they perform top surgery, they pretty much take your nipples off and put them back in a completely different place. And I feel like my body is experiencing a disconnect where it's feeling the nipples where they used to be, not where they are now, and it's really uncomfortable. And when I get this feeling, my first instinct is to like touch the area, but then I quickly realize that that'll make me more uncomfortable because it's likely that the area that I'm gonna touch is not where my nipple actually is, and that'll just blah. So that's been fun. I've kind of just been trying to ignore it, but I don't know if this is like a foreshadowing of having actual nipple sensation in the future. I did retain nipple sensation after my previous surgery, so I don't know if that means anything, but God, yeah. Alright, let's do this. Since it's a chest video. Oh, good. Okay. So this is what I look like 11 months post-op. This chair is very convenient. So, no complaints, right? Even if the nipples are feeling a bit weird, I like how they look, so that's most important to me. It's hard to tell in this lighting, but I still have that one little patch about that big that's thicker and harder than the rest of my scars. But, I mean, like, you could barely see them. Like, look at this side. It looks like there's nothing there in this lighting. That's ridiculous. It's a bit more visible in real life, but, like, no complaints whatsoever. To anybody who is looking for a surgeon, McLean all the way. Absolutely, 100%. His staff are amazing. He's amazing. Just, yeah, go there. So that's it. That's all I wanted to say. Also, one of my dogs fell asleep on my stomach today. a 6-month-old beagle puppy. That happened. So it's been a good day. She didn't touch my nipples, or maybe she did and I didn't even know. Such a weird feeling. Okay, I'll talk to you guys soon.